as a patient and a patient advocate, but after hearing from Dr. Amrine, I'm not sure you need to hear from me because that's an exciting future that we have ahead of us. I'm pleased to be here as an Albertan and on behalf of Imagine, Citizens Collaborating for Health. Imagine is a citizen-led initiative focused on engaging Albertans and healthcare professionals to work together to design an integrated, person-centered system that achieves the best possible experiences and outcomes for our patients. I'd like to thank all the organizers on behalf of Imagine for the opportunity to participate today with this group as we look to work together to better understand the power of integration and transparency of health information. Dr. Rabi and Shamali in our convening document have a great opening statement. They say that highly informed patients and providers will be better enabled to achieve optimal health outcomes. Indeed, the benefits of integrated healthcare models and integrated health records have been well documented, and these benefits are experienced by the patient, the provider, and the system itself. My role this morning is to set the context of this discussion from my point of view as an Albertan, a citizen, a patient, and a patient advocate. But this conversation is really about all of us. We've all been patients at the bedside of patients, advocating for patients, and I believe we all have opinions about how our health information should or could be shared. I personally believe that information is power. It is the great equalizer, but only if it's shared. So a little more about me. Many of you know me. I do have a disclaimer. I may be a proud Albertan, but I'm also a health professional. I've been blessed with a 30-year career in healthcare, and during those years, I've had considerable experience in the clinical setting as a patient advocate with primary care initiatives, clinical improvement projects, information management and technology projects, and numerous other experiences. 30 years ago, as a young registered nurse, I participated in a nationwide health information initiative where we observed the use of cumbersome handheld devices scanning barcodes and entering patient information into a yet not well understood electronic patient chart. In those days, many of us had not even held a mouse to manage our computer screens. We didn't own personal computers, and we relied generally on corded phones. We couldn't envision what we called a paperless system, and most of us certainly didn't understand what an electronic health record might look like one day. So fast forward 30 years. I have a smartphone, an iPad, a PC, a laptop, a cordless phone, and numerous other devices that I play with. I have disruptive technologies on my wrist half the time. But recently I participated in a demonstration of a real-time electronic patient referral system that links any one of those devices that I have and allows me to respond back as a patient, participating in decisions associated with clinical referrals to support my care. We've come a long way in 30 years. I've found over the last 30 years that the impetus for change often arises not just from an innovation or an idea, but out of personal lived experience. We all have our stories, and I'm no different. I may have experienced being a healthcare professional in the acute, emergency, and community settings, but I've also been a patient advocate, and a family member at the bedside many, many times. And as a patient, I've heard this stated many, many times and implied many times, and I'm sure you have too. If you don't hear from me, assume everything's okay. A statement like that, while well understood from my point of view as a provider, puts me as a patient squarely in a submissive position. As a recipient, as someone who waits politely, someone who's required to trust that the system will inform me, rather than having the opportunity, the right, and some would say the responsibility to participate as a partner in my own care. And when statements like this are used, it also creates a set of assumptions that can be damaging in the long run. My colleague, Dr. Tony Fields, in December 2014, in the Continuity of Patient Care study, or what I like to call the Greg Price story, stated, "This is not an easy story to read. We learn of a patient who is burdened with coordinating his own care. Probing this case lets us look closely at specific problems within the system. More importantly, however, it helps us remember that people are at the center of the healthcare system," end quote. Ultimately, in sharing Greg's story, we learned that continuity of care, largely associated with multiple breakdowns in communication, was at the heart of that tragedy. Greg's story could be your story or mine. We are all patients at some point, and that always creates vulnerability and always requires enormous degrees of trust. So here are 3 examples that I'd like to offer you from my own lived experience. I have a 29-year-old niece with a 12-year history of complex lupus. On occasion, she's cognitively impaired, either through the exacerbation of her illness, a side effect of medication, fatigue, depression, or postoperative care. She's frequently forced to tell and retell her story to different specialists and other providers. Her mother's efforts to advocate for her have been confusing and suboptimal because she neither has access to the necessary information nor is included in the discussions unless she petitions pretty aggressively. My niece was told 2 years after receiving continuously high-dose prednisone for 14 months before she was weaned off the drug that the joint pain she was experiencing was arthritis. After waiting another 6 months, x-rays and a subsequent MRI were done, and about 30 months from the onset of her joint pain, she was told, if you don't hear from me, assume everything's okay. Everything was not okay, and she did not receive a call regarding her results, so when she finally did reach out, she was told she had widespread avascular necrosis. So more on that later. Another example, my husband is chronically ill. One Saturday, I attempted to arrange for him to see a physician from the same primary care network that we belong to. The physician on call was able to speak to me on the phone, and when he agreed that Bob needed to be seen and assessed, processes were not in place to enable him to see us, so he recommended we find a walk-in clinic. Our ability to ensure continuity of care by enabling an on-call physician from our own PCN to have appropriate access to my husband's up-to-date health information was impossible. Not suboptimal, it was impossible. I called around to various walk-in clinics. Most, if not all of them, had closed at 1 o'clock in the afternoon. So ultimately, I was forced to take him to the local emergency department, where his electronic medical record is currently not available or accessible, and we retold his story to yet another caring, well-intentioned, but uninformed provider. Incorrect assumptions were made that did not take into account the implications associated with his chronic illness. I attempted to correct those assumptions, and some treatment was initiated, but never communicated back to his family physician. We were required to follow up with her to fill in the information gaps, and he's currently waiting to see another specialist. Keep in mind that I'm a health professional. I can ask different questions. I can answer questions in a different way. I can probe, interpret, and advocate. When health information is not fully integrated across the system and up to date, and we are physically or geographically disconnected from our family physicians or other members of the team, not to mention the valuable electronic medical record, and if a health professional who knows the system the way I do is unsuccessful in her attempts to support continuity of care, how do we expect lay people to manage? More on that later. And one final example. My husband and I are advocates and caregivers for his very elderly parents, who are determined to remain in their own home as long as possible. My 87-year-old father-in-law has had 2 strokes, mild dementia, and profound hearing loss. My 82-year-old mother-in-law has heart disease, a pacemaker, scoliosis, osteoporosis, significant mobility issues, chronic severe pain, and anxiety. In our role as caregivers or advocates, the system is not yet set up to allow us access to their health information, or even to remain with them when they're in the clinical setting. When one of them ends up in the emergency department, we're left sitting in the waiting room for extended periods of time, excluded from the bedside while initial assessments are undertaken. That can be a little problematic given the dementia and the hearing impairment of one and the complex physical and emotional needs of the other. More on that later as well. So as Albertans and patients, transparent processes that allow us to have access to our health information are critical if we are to be true partners in decision-making around our own health care. Transparency builds trust, and if we as patients don't know what our health records contain, that puts us at even greater risk. The concept of co-production comes to mind. Co-production refers to a truly shared partnership between patients and providers without undue influence. Dr. Flemons and colleagues emphasized in their 2016 white paper that, quote, citizens have both the right and the responsibility to be involved in designing, and I would add, and contributing to, a healthcare system that works for people if they're to fulfill their duties as citizens, end quote. So if you agree that information can become the great equalizer only when it's shared, then I would challenge all of us today to think about something. We must create an integrated health information management system and an integrated health record that allows transparent access to the patient's own health information. And we've heard a moment or so ago that that's underway. So it's an exciting time to be in Alberta. But we are all patients at some point, and when we're healthy, access to that information isn't necessarily that important to us. But just become ill, because when we become ill, it's a completely different story. And access to that information can be life-saving. Errors, omissions, delays, or incorrect assumptions can be corrected on a patient's record before we're in crisis, before we're in an emergency department. Better and more crucial questions can be asked, and the provider-patient relationship can be enabled to become a true partnership. But there's also an enormous amount of really great work underway to advance the integration of health information, and in spite of the challenges we face, I am extremely proud to be not only an Albertan at this time, but an Albertan who's been part of the health system for as long as I have. Some of the things that have been happening more recently. Electronic health records are in place in Alberta. A province-wide clinical information system project is underway. A patient portal is being tested and used as we speak. 42 PCNs, or primary care networks, in Alberta across the province use electronic medical records to support more than 3.5 million Albertans. Most, if not all, primary care networks have team-based care in place, and some, like Chinook's PCN, have integrated information systems that provide up-to-date stats relative to primary care network performance, patient outcomes, and other patient-specific information that allows providers to amend workflow patterns, allows improved decision-making, and better follow-up with patients. Imagine Citizens Collaborating for Health has a primary health care consultation project underway that will enable us to better understand what Albertans know about primary care and what they want from an integrated system. The Health Quality Council of Alberta has just launched their web-based, fully public FOCUS project for the emergency department. FOCUS stands for Fostering Open Conversations that Unleash Solutions. That title is innovative even in itself. And a Health Information Standards Committee is a multi-stakeholder group that has developed health information data and quality standards for Alberta. The work of this group aligns with Alberta's IT strategy. As a patient, I've also personally experienced enormous change and improvement over the last 30 years. Today, if I see my doctor, she offers me copies of lab results and other diagnostic imaging reports, including specialist opinions. That was virtually unheard of at one time, and it offers evidence that our culture is beginning to change to one of trust, sharing, and more respectful engagement. Today, my doctor relies on the electronic medical record to maintain my health information and keep it up to date, and I've come to appreciate the speed at which she can look up information that we may need together to make a decision about my care. Today, my physician and I talk about maintaining wellness rather than just relying on episodic illness to be a reason for a visit and a conversation. And today I can source out information ahead of time from multiple places, and she nearly always has the time to spend answering those questions and working with me to find appropriate solutions. So I promised you some updates about my 3 patient examples. Regarding my niece with lupus, the lack of identified and appropriately communicated risk associated with high-dose long-term prednisone use, which, by the way, was life-saving at the time, led to irreversible and widespread avascular necrosis. She had both hip replaced at the age of 26 in the fall of 2015, and she's currently on the wait list for bilateral cadaver ankle replacements. Both knees, both shoulders are also diseased. She has a long and difficult road ahead of her, but she has a fantastic team of health professionals who, for the most part, listen to her, communicate with her, and are doing everything that they can to support her. My husband's story is really about who should have access to health information, and we heard from Dr. Amrine about how patients should have full, transparent access to information. The emergency department visit I gave you was only one example of that. His local cardiologist called him 2 months after his angiograms to ask if he had even been seen yet. It turns out that all clinical information for the visit was never sent to our specialist, and some was indeed lost. Fortunately, Bob asks great questions, and we went home from the hospital after the angiograms with a complete copy of his chart, including all photographs, opinions, and outcomes. A simple question, his willingness to ask for copies of his chart, and the facility staff's willingness to provide that information allowed Bob to take complete copies over to the specialist's office immediately. His plan of care changed substantively because of one simple conversation when he was at that tertiary facility for his procedures. He's taking care of his own health in partnership with his family physician, where he discusses his activities and his occasional crazy plan to go prospecting up in the wilds of northern BC by himself for 3 months at a time. But that's Bob. That trusted relationship has allowed her to better support him to make better decisions. He's changed his diet. He works out 4 days a week at the local gym. He's lost 30 pounds. And we are learning together about how to access care during non-primary care network hours, and take the right information with us so that we're better prepared to make better decisions next time. That's our responsibility. My husband's elderly parents, well, that's an adventure every day. They have home care staff, a chairlift, some homemaking support, 2 great physicians, and a son who does his best to anticipate issues before they become problems. With regard to our efforts to gain access to their information or to be allowed to accompany them when they're accessing emergency care, well, that's an issue of culture and relationship and trust. And what can I say? It's a work in progress, and it's part of the adventure. At the end of the day, our efforts to create an integrated health system will be enabled not only by choosing the right technologies that'll ensure interoperability, security, transparency, and scalability. We will be enabled and successful when we do our part to ensure that the culture adapts to this new world, and we learn to work more effectively in a spirit of co-production with clarity and trust with our patients, our stakeholders, and our partners. So when I was writing this presentation, thinking about all that I've learned in the last 30 years or more, I saw 10 key messages. And there's tiny writing, I hope you can see that, but I just thought I'd put them on a screen, on a slide to show you. So, you know, what I learned from preparing this for you today is that, Dr. Fields, people are at the center of the healthcare system. Something that I thought, nothing devalues a relationship faster than inequality. If you don't hear from me, assume everything's okay. That assumes that the provider can't possibly get so busy that they can't look or miss something. We are all patients at some point. Don't assume that what information patients may need. Chances are you'll be wrong. Quote, highly informed patients and providers will be better enabled to achieve optimal health outcomes, and that's from our convening document. Co-production, citizens, I have glasses. Citizens have the right and the responsibility to be involved in designing and contributing to the healthcare system, and I spoke about that earlier. Enable providers the time to build and nurture the relationships with their patients that are necessary. The culture needs time and support to adapt to this new world. And from Dr. Daniel Martin, Canada is a nation of pilot projects. And, you know, I've been part of lots of pilot projects. There's good work has come out of it, but we've got to stop piloting and start doing and start scaling. So invest in change management, identify options for opportunity for success, allow time for practices and processes to adapt to ensure sustained and optimal use of the innovations that we have. And information, again, is the great equalizer, but only if it's shared. Thank you very much.